Okay, good evening, everybody. I am Gareth Perry from the University of Minnesota, and I'm going to be talking to you, as you've already been told, about prognostic indicators in MS and the importance of early treatment. This is, I think, an important topic because there are, of this therapeutic conundrum in MS, I'm just going to have to make a change in my screen here because I can't properly see my slides. There we go. We know that MS is a progressive disease, and it almost inevitably results in disability. And the studies by Dr. Weinschenker from the natural history cohort in Canada in the 1980s showed that only 45% of patients who had not been treated were still able to walk without assistance after 10 years. So that's a fairly gloomy prognosis. We also know that MS treatments, all of the ones that are currently available, target the inflammatory phase of the disease and are most effective if started early when inflammation is most prominent. But there's a caveat, and that is a proportion of MS patients have benign MS and may never need to be treated. And this was first pointed out to us by John Kurtzky in the early 1970s. But a more recent study from the Mayo Clinic group headed up by Dr. Pittock published in 2004 showed about the same thing. And it was interesting that these two studies done 30 years apart both came up with about the same percentage, about 15% or 20% or a little less of patients have a benign course. And of course, the MS treatments are a little unpleasant. They all involve injectable therapies. There are risks to taking them of various degrees, and they're also very expensive. And so the ability to predict the future course of the disease in MS would obviously be invaluable if it would enable us to identify those patients in whom treatment should be started immediately. And that subset, that 15 to 20% of patients who could be safely observed and perhaps may never need to be treated. And the good news is that a large number of factors have now been identified that can provide us in guidance in identifying those patients for whom early treatment would be important. And what we're going to cover in the next few minutes are prognostic features that we can identify at the time of the initial clinically isolated syndrome. That is the very first attack when a patient cannot be diagnosed with definite MS. And we'll discuss the results of several studies that have been done in patients with clinically isolated syndromes, and with their acronyms are listed there for you. And then we'll look at the prognostic features in patients who have already reached the stage of early MS, and now they have definite MS, but even those patients may not necessarily need to be started on treatment.